Welcome to Dr. Boms YouTube channel. I hope we have all been doing great. Today we have a very interesting topic we'll be discussing, and it's no other than goiter. Did you know that just a simple swelling in your neck could be a sign of a serious health problem? A lot of people ignore this silent condition, but it can affect a lot about you, including your breathing, swallowing, and even your voice. So in this presentation, we'll be exposing the hidden dangers of goiter, what causes goiter, what are some of the symptoms and the signs, as well as management types. Please stay with us to the end because you might just save a life, including yours. As a way of introduction, I'll say that goiter is a condition that results in the enlargement of the thyroid gland. The thyroid gland is a gland that is located in the anterior part of your neck, or the front aspect of your neck. This gland is crucial for regulating your metabolism, growth, and energy levels. When it swells abnormally, it can cause various health complications. But what really causes goiter? But what we are interested today is in what really causes goiter and how we can prevent it. So let's find out. Goiter develops due to several factors, including 1. Iodine deficiency. Your thyroid gland needs iodine to function properly. We have elaborated on some of the functions of the thyroid gland. That includes metabolism, regulating your body's growth and energy levels as well. So for your thyroid gland to function properly, you need iodine. A lack of this iodine forces your gland, the thyroid gland, to work harder, leading to the swelling you see in the front of people's neck. This is a major cause of goiter in many parts of the world. The next cause we are interested in is hormonal imbalance. Conditions like hypothyroidism, that's an underactive thyroid, and hyperthyroidism can trigger thyroid enlargement. Genetics. If goiter runs in your family, the person is at risk of developing goiter, even a higher risk. Then we talk about autoimmune disorders. Graves' disease, for example, and Hashimoto's thyroiditis. These are conditions where the immune system mistakenly attacks the thyroid, causing inflammation and swelling. Certain medications, like drugs, for example, lithium, used for mental health conditions, can interfere with a person's thyroid function. Pregnancy as well and menopause can cause hormonal changes. And during this phase, a person is likely to develop goiter. So, what are the symptoms? How will the person who has goiter feel? What are the clinical features? Goiter sometimes may depend on the size. The symptoms of goiter depends on the size and the cause. And so these symptoms vary from person to person. Some people may not even experience any symptoms at all. However, common signs include 1. Visible swelling at the base of a person's neck, difficulty swallowing or breathing, hoarseness or voice changes, persistent cough or throat discomfort, fatigue and weight changes. In cases linked to thyroid dysfunction. So these are some of the experiences the patient or the person will be having. Voice changes, person may be coughing a lot, throat discomfort, change in the person's breathing pattern and difficulty swallowing. Person feels easily tired or is losing a lot of weight. So if you or someone you know experiences these symptoms, it is important to seek medical advice immediately. So we move over to the treatment and prevention. The good news is that goiter can often be managed with simple lifestyle changes and medical treatments. And here are some effective ways to prevent and treat goiter. 1 is increasing your iodine intake. For instance, when you are buying salt in the market, ensure that the salt has iodine in it. You can see it from the pack of the salt. If it has iodine, always ensure that the salt you're buying has iodine in it before you purchase it. And we advise to consume iodine-rich foods such as seafood, dairy products like milk, eggs, and the rest of them. And like I already said, iodized salt. This is very important to help increase your iodine intake. 2, we have to maintain a balanced diet. Eat foods that are rich in selenium. For instance, like Brazil nuts and sunflower seeds. Those people that can get in contact with all this, please try and eat this, as well as zinc found in meat and nuts to support your thyroid function. Just make sure you are eating a balanced diet with containing lots of fruits, vegetables, and then your proteins, carbohydrates, and what you have. So avoid also goitrogenic food in excess. Some food like cabbage. A lot of you like eating cabbage, broccoli. This will interfere with thyroid function if consumed in large amounts. So let's try, and when you're making salad, you combine. You don't eat too much of cabbage. Too much of it can affect the normal function of your thyroid gland. So also medical treatment. This depends on what the cause is. So we always advise patients who have this anterior neck swelling to visit the hospital for proper care. You'll be asked to do certain investigations like an X-ray of your thoracic inlet. You have to do thyroid function tests, just to mention a few. They do a hormone therapy, and even if in severe cases the goiter has to be taken off, they perform a surgery for you, and the person feels better. And it's important afterwards you still go back to the hospital for checkup, for follow-up. For patients or people who have family history of thyroid problems, you have to get your thyroid levels checked regularly to detect issues of your thyroid early. So it's important that you check your thyroid gland, you do a thyroid function test as regularly as possible, just especially those who have family history of goiter, or even staying in places where, like hilly places, where they hardly, because of the hills and things like that, their environment prevents them from really having adequate uh, iodine in their water, in their salt and all that. So we encourage them to regularly get their thyroid levels checked, so that if there are any issues with the thyroid, this can be detected and managed early enough. So goiter may seem harmless at first, but can lead to very serious complications like malignancies. In simpler, it's important when you notice an anterior neck swelling, you or whoever is noticed in reports immediately to the hospital for proper care and checkup, in order to prevent further complications that goiters can cause. For instance, malignancy, in simple terms, cancer. Some goiters develop into cancerous ones. Some simple goiters become cancerous, sometimes due to delay in presentation, or they've been there for many years with no symptoms. So the person just thinks that is a simple goiter, not knowing that it's malignant, or has become cancerous. And then anterior neck swellings can be as a result of other causes. That is why we advise people to go to the hospital immediately you notice you are having a neck swelling, so that you can be better taken care of. And that's why we are doing this video, to create awareness on the importance of regular checks, regular visit to the hospital for patients who are at risk of developing a goiter. They need to be checking their thyroid function. They need to also examine the thyroid for any issues. So now that you all know the causes, Symptoms and treatment options. Please don't ignore any unusual swelling in your neck, as I've already said. Please share this video with your friends, with family, to spread awareness of goiter. It could save lives. If you found this information valuable, please don't forget to like, to share, and subscribe to Dr. Boms YouTube channel for more health tips. Let us know in the comments, have you or anyone you know ever experienced a goiter? Please discuss below in the comment box. See you in the next video presentation, and remember, your health is your wealth and our concern. Thank you very much, and have a